Now, more specifically, when you're someone who is trying to get pregnant, we talk about thyroid and pregnancy. So one of the first things that people hear whenever I say something like I just talked about is some people think it means, well, if my thyroid's not working, I cannot get pregnant. And then others say, well, clearly you can't be talking about that for real, Dr. Duke, because I have thyroid problems and I got pregnant. Well, the truth is both cases apply. Some people, because of their thyroid, they will not get pregnant or they really, really struggle. Others, despite their thyroid issues, will conceive. But the bigger issue is what happens as a result. So we know, for example, that women who have thyroid disease, particularly autoimmune thyroid disease, especially if you have certain antibodies directed at your thyroid gland, they are at increased risk for miscarriage and stillbirth. Those are things we know. The other thing we know, and we've known this now for at least a couple centuries, is if a mom's thyroid is underactive, particularly if it's autoimmune type underactivity, like if you have Hashimoto's and a lot of high thyroid antibodies, your antibodies can cross the placenta and actually attack the thyroid of your developing fetus, of your growing baby. So in turn, that baby can become hypothyroid in the womb because mom's antibodies, mom's autoimmune antibodies have crossed into the placenta. And as a result, it causes distinct issues with the forming fetus. So it causes the brain not to develop well. It causes the fetus not to grow well. So it has what we call stunted growth or growth restriction. As a result, you can have a very small baby delivered. You can have the baby stop growing and doctors needing to deliver you emergently to try to bring this baby out so that it can thrive. It may need to be born to rescue it from all of those antibodies that are crossing, that are affecting its general health. We know from long-term studies that children born to mothers with particularly hypoactive thyroid, so underactive thyroid, they have higher rates of mental disability, learning disability. And so these are things that have direct impact on the outcome of your pregnancy and long-term neurodevelopmental impacts on your child, including IQ, right? You see differences in intelligence quotient, so to speak. In terms of other aspects related to pregnancy, when it comes to hyper or overactive thyroid, if someone is having like an acute early Hashimoto symptoms, they can have what's called a thyroid flare, and it can, if it's not caught early, land a pregnant woman in the intensive care unit. It's called thyroid storm, and it's considered one of the biggest obstetric emergencies that we have to deal with because it can literally lead to mom stroking out her placenta even. And so it's really important because it can cost us both mom's life and the baby's life if we don't catch it. And so that's called thyroid storm. And it's one of the top 3 obstetric emergencies that we face, because if we don't deal with it within a matter of hours, we can have really detrimental outcomes. And so those are the things to know about and why we care about it so much. And not only do we care about hyper and hypo, but like I said, we care about an in-between, which is called subclinical. Because subclinical hypothyroidism, we know, has more impact on egg quality than we thought. It also has more impact on miscarriage risk than we initially thought. And especially if it's subclinical with the presence of antibodies. Because like I told you earlier, if someone has positive antithyroid antibodies, they're at higher rates of miscarriage and stillbirth. And so now we have to take certain preventive steps if they're identified.